Morning, everyone. It's great to see some of you again. My name is Dr. Kitty Yan, and I represent the Center for Chiropractic Health in Lombard. Today, I want to take some time to talk to you a little bit about a class that I believe will make a huge difference in the enjoyment of your life. I want to talk about living well for life. Now, the stats say that some of us are going to live to 100 years old, which sounds amazing. If that's the case, I want to make sure that that life is a quality life. I just don't want to exist or lay there. What about you? So, I know you're thinking, 100 is far-fetched and ambitious. She's crazy. Well, it's not too early to start thinking about some of the facts. Let's take a look at what they're saying. In the 1900s, the average lifespan was 49 years old. There's no question that this is because many people died when they were very young. We didn't have the kind of cures. We didn't provide the same kind of health care that we provide today. That's the point. Everybody's chances of living a long, healthy life was much less back then. As a matter of fact, the average lifespan today is 82 years old and growing. And a recent study by the United Nations Department of Social and Economic Affairs found that by the year 2050, which is only 30 years from now, there would be more than 3.6 million people over the age of 100, many to 150. So seriously, what does that mean? It means that your kids need to know more about how to live well for 100 years than they need to know how they're going to spend their inheritance, because you're probably going to live so long that they may be retired themselves before they even get any inheritance, assuming that there is some. Yep. So this is a topic that you and your family need to know about, because the odds are high that you and your family are going to live for 100 years. And so you need that long life to be a quality long life. We don't just want to spend literally 40 years of our life unable to move around. We want to be able to live and work and travel eventually and play on this planet and have a quality life. And we want to live well the whole time we are alive. So since we are going to live many years past the age of 50, what happens to us after 50? Because a long life reveals that there will be some major areas of health concern after 50 if we don't do something before we are 50 to prevent those problems. These are health concerns we haven't had to worry about before because we didn't live long enough to experience these problems and make it a priority. For instance, we are being confronted with the devastation of the disease like Alzheimer's and dementia. Most of our families have had to face this. But this disease didn't just start in the last 10 years. We just see a lot more of it now because we're living longer. Dementia doesn't usually come on a person under the age of 50, but now that we realize the chances are much greater that we're going to live past 50, we need to take some precautions to make sure we can use our minds when we get to this age. Okay, let's talk skin. Old skin has brought about a huge growth in cosmetic surgery. Many more people are trying to correct the wrinkle problems that come with aging. But the biggest problem we see with an increased lifespan is the increase in musculoskeletal problems. In other words, your mobility, your function. We just cannot move around like we used to. Take a look around. Our world is filled with canes, walkers, electric wheelchairs, walk-in bathtubs, more handicapped parking spaces. We are seriously the first generation to witness the ramification to mobility that long life creates. It reveals that we have done nothing to preserve and protect our musculoskeletal system. And so what happens now? Let's take a look at the results of our neglect. The most common cause of functional disability in people over 50 years of age is spinal disorders. This is because most of the population has done absolutely nothing to prevent spinal disorders. Most people who have pursued any chiropractic care have waited until they were in crippling pain first. It's like people are planning on dying before they turn 50 because nobody is making any effort to prevent the number one health problem for people over 50. Again, spinal disorders. Okay, so we do nothing for our kids, nothing for ourselves until we can't move. And then we go see a chiropractor. We see this all the time in the office. And maybe, I'm going to ask you right now, how many of you plan on living past 50? How many of you think your family members will live past 50? Come on, the stats are really high on your side, and you probably will. So this means that we need to live like we're going to live past the age of 50 and take care of what we know is going to happen to mobility unless we do something about it. Okay, here's just a simple example. Your house is going to get broken into by someone and they're going to steal all of your possessions. You knew who was going to do it, you know when they were going to do it, and I could even tell you about it. Would you do something or would you stop it? Okay, of course you would want to do something about it. You're not just going to let it happen. You're going to do whatever it takes to stop it, right? So in this class, I'm able to tell you what is going to rob you of your functional capacities, what is going to steal your ability to move, and when it is going to happen. And it's going to make you feel and look very, very old. So should you do something about it? Should you do something for your kids or for your spouse, for your family? Or are you just going to let it happen to your family anyway? Of course not. Let's prevent it, guys. We want to make sure that we, just like we prevent somebody from breaking into our home if we could, I think we should all work harder to prevent our ability to function and move from being stolen from us. Seriously, think about it. If we lose our mobility at 65 but live to 105, that's 40 years of immobility and pain. Don't let this happen to you. And don't forget, this is not limited to back pain. You cannot get a new neck either, okay? Now, many of you want to use your neck past the age of 50, right? And so there's a study that showed out of 10,000 adults that shows that 85 out of 100 have back pain, 1 in every 3 have neck pain. So these stats are pretty high. I think it's pretty convincing that we need to do something preventive about this mobility problem. But in case you need a little bit more convincing, let's take a look at what would happen if we just let nature take its course and we did nothing preventive about this. Pay attention, guys. This is really interesting. So this health span curve represents a few things. If you look at the bottom, it represents your age by decade. And on the vertical scale, it represents your capacity of maximum function. So you can see that we reach about 100% maximum mobility at about age 25. How many of you guys are 25 out there? Not me. So look at the yellow line, how it just drops after the age of 25. And at about age 55, you only have about 50% of the mobility you had when you were 25. And look at the graph, how it continues to drop like a rock. So at about age 70, you only have about 25% of the mobility you had when you were 25. Okay, so what does this mean? Can the scale be changed? Or is it absolutely too late? Can we alter any of these results? Because at this point, many of us are past the age of 25. So the good news is with preventive care, we can make some huge improvements in this graph. Again, look at that yellow graph and see what happens if we just let nature take its course. And look at the green line and how we can change that with some preventive care. On the green line, you can see that the mobility is actually maintained at about 75% through the years of 80 years of age, based on just normal wear and tear. Okay, so that is what you and I need and want. And that's what you want for your family too. Because if we are all going to be here, if you're going to be here, you might as well be able to move and function. So why not get preventive chiropractic care for your whole family to make this happen? Well, I know the one thing you might be thinking is, how does chiropractic work for me and my mobility and my health and wellness? Okay, this is the fun part. Okay, your body is the greatest healer we have. We don't realize what a magnificent healer the body is, but how does that really work? The body heals itself through the central nervous system. The brain, that controls everything, tells the organs and the body parts what to do through your nerves. It is like your body's telephone communication line. This is how we get good movement, quick body response, and also good, healthy, natural healing. Now, you guys, health problems occur when the communication is cut off or interfered with. Just like we experienced on a cell phone call today, sometimes there's interference or a dropped call. The main thing which prevents health and wellness, health and healing in our bodies is interference through misalignments of the spine, preventing communication between the brain and all the body parts. These misalignments are also causing mobility restrictions, and it slows down the body's normal responses. Okay, so this is where I come in. Chiropractic works by removing the misalignments and nerve interference. It restores the body's mobility And then the communication of the body is 100%, and that's what you need for health and healing and peak performance and function. The chiropractic adjustments, they remove misalignment of the spine that is going untreated, which causes unnecessary wear and tear of your musculoskeletal structure. Just like a misalignment of the tires that you have on your cars sometimes causes unnecessary wear and tear, you keep them aligned properly so you get the most mileage out of your tires. That's the same thing with our bodies, guys. We need to make sure we get the most mileage out of our bodies. And we also treat a lot of kids in our office also, and so you can see why. It's because we need to prevent these future health problems before there's permanent damage. Again, here's how it works. The brain communicates to the rest of the body and organs how to heal itself. It does this through the central nervous system. Okay, for example, did you ever wonder how the body knows what to do when you cut yourself? Like, how many paper cuts do you get in a day? Like, how does it know to stop bleeding? And how does the skin grow back together and not even leave a mark on your skin once it's healed? You can't even see that it's there. The body is a magnificent healer, and natural healing is the best kind of healing there is. The brain tells the body what to do, and it does it, as long as there's no nerve interference. Okay, so some of you are wondering, what is nerve interference? Why do we get it? We have tons of activities in our lives throughout the day that together creates nerve interference. We fall, there's jerks, there's turns, there's spins, there's sedentary lifestyle. All these things can cause a breakup in our nerve communication line, and the nerve gets pinched, and then our healing calls are dropped, and this is totally unacceptable. We have to keep good communication with all the body parts. Make sense? And so you can see that just life in itself and all of our daily activities can cause misalignments and nerve interference. This is what restricts our mobility and our health and our healing. So the real problem is that most people have left this condition untreated their whole entire life. They wait for pain, they wait for permanent damage, they wait till they need surgery before they do anything about it. So today you see a population of people in pain, and they have very severe and limited mobility after the age of only 50. Once again, the solution to this number one health problem is chiropractic. Chiropractic removes the misalignments and nerve interference, and it allows the body the freedom of mobility and quick responses and good healing time, so that the body can heal through the communication of all the body parts. It's the foundation to wellness. A lifetime of wellness is where we need to change that mobility scale. Isn't that what you want? I mean, in this day and age, especially for a lot of us who are working from home and in a different environment where the ergonomics may not necessarily be ideal. You know, this is a big problem during this time, and so we want to make sure that we have good health and good mobility to have lasting wellness. Now, I know that some of you who are listening have these running thoughts through your mind, and you might be thinking, I knew it, I always heard chiropractors want you to come for the rest of your life. Okay, so before we decide that it's a bad thing, let me ask you a question. Does it really make sense that you can have your nerve interference removed once and then it's good for life? Seriously, does anything really work like that? Can you wash your car and just, it stays that way, so clean, so perfect? Can you take a shower and stay clean for the rest of the week or for your life and never do that again? Or how about this one, my favorite? Can you clean your house and it just stays clean? Absolutely not, especially in my house. After 1 hour, it is a complete mess from my children. So, what if I spent 6 months going to the gym and getting in shape and have strong muscles? Okay, according to this logic of one and done, my muscles would just stay that way, right? I'm done for life. Once I'm in great shape, it requires no maintenance, no work, no attention, no time, no money. I never have to go back to the gym again. Yeah, right. I wish it worked that way, but it does not. Health and wellness does not work that way. It is obvious that you're never done. You have to keep going back to the chiropractor. Health maintenance requires time and money, and the most effective results possible. For the most effective results possible, I choose chiropractic care. And if you don't maintain your body and skeletal system, it's going to take a much higher toll. Age is cruel. You need to do everything you can to prevent the loss and deterioration of your health and body. Don't wait until you've lost it. You can lose your ability to enjoy your life's activities due to the lack of prevention and care over a period of years. Just look around. Again, TV is full of ads for walkers and walk-in bathtubs and chairlifts even, motorized wheelchairs. And is that how you really want to spend 40 years of your life because of a lack of maintenance and prevention? No way. I not only want good health for myself, I want health for my kids and my grandkids. I want to live well so I can keep up with them when I'm older and when they're older, the whole time we're alive. So yes, we want you to keep coming back, and that's why we want you to come back, because chiropractic is what works for natural wellness so that we can all finish strong. So obviously, you and your family need to come into our office and be evaluated for a simple, easy, healthy plan towards preventing a life of immobility and poor posture. The good news is that we can do something this important for you and your family at almost no or little cost. And honestly, guys, I've met a lot of you guys already. You know, this isn't something that I feel that you should do for wellness. It is something that we should all do. I'm a regular patient too, and so is my family. I started chiropractic as a 16-year-old teenager. I had some serious hip pain, and I was out of commission, and I couldn't do my varsity sports, and it sucked. And when my doctor kept giving me arthritic pills at that time, and they never helped, all I could do was sit on the bench. And when my teammates asked me what's wrong with me, I said my hip hurts. And they said go to the doctor, and I did, and it didn't help. So when my friend encouraged me to see her chiropractor, it really changed my life. I just thought it was miraculous. I loved how it made my body feel. My hip pain was absolutely gone. And as a 16-year-old kid, I was back to my sports and just living the life I need to live as a 16-year-old woman. And so this is more than just a class for me, guys. It is my chosen foundation of health and wellness too. So here's what I would do today if I were you. Just wanted to talk to you about a special offer that we're having in our office. So listen up. So guys, we want to make sure that we put your health and wellness in your future ahead of everything else. So here's what we want to do. You can call us at our office and we'll schedule you for a consultation, exam, x-rays if we need it, and a report of findings for only $39. And in turn, we'll take that $39 and we will donate it to the Outreach House in Lombard. That way it gives you an opportunity to see what's going on with your health and an opportunity to see how we can get started for a true life of health and wellness. Now, in order to take advantage of this offer, you need to call us at the office to make an appointment. We just don't take walk-ins, okay? 630-268-2680. And please mention the Catholic Order of Foresters virtual wellness event. And then that way we know that this is where you found us. Thank you so much for listening today. We appreciate your time and hope you have a great day. Bye for now.